Morning, Dr. Patino here at the Cosmetic Surgical Center of Osarito. So we are doing an upper blepharoplasty under local anesthesia, and she has received some medication by mouth to sedate her, but notice the complete absence of bleeding. ¿Estás despierta o no?
Sí.
Yeah, she's awake. ¿Y cómo te sientes?
Bien.
¿No tienes dolor ni nada de eso?
No.
Estamos apenas empezando la cirugía. No sientes nada. Increíble. Okay, so you can notice the complete absence of bleeding. We're doing this under local anesthetic, okay? It's incredible. So now we're gonna go ahead and take this piece of skin out, okay? And notice how I pick it up, right? And we're gonna go ahead and gently tap it. So that we do this in a completely bloodless manner. Not a drop of blood here, you guys. Look at that, incredible, right? So it's a little blood vessel here, is what I do. This is the Patino method, so to do this bloodless surgery. So every surgery that we do here, you see this blood vessel here is a capillary. These are little tiny things, right? But I just don't let them bleed at all. So if you want to do a real good close-up, so you can see how we are doing this in a completely bloodless manner here at the Cosmetic Surgical Center of Osarito. This is just incredible surgery, and the patient is totally awake. We can do this awake, like this patient is, or we can do it under IV sedation, or we can even do it under general anesthetic, depending on how you feel, right? But if you're not very nervous and, so let's hear from the patient. How do you feel? ¿Cómo te sientes?
I'm good.
She's good. ¿Te sientes bien?
Sí.
No. ¿Recomendarías esto?
Sí.
You would recommend it, right? We're just slowly but certainly just removing this area into a little blood vessel. So in the eyelids, you don't really want any bleeding at all. So this Patino method for the upper blepharoplasty is incredible because it's much less risk in complications, see? We basically just do this in a completely bloodless manner. And so for this last part, let's do because I'm about to, might as well take it out. So this is the way it is here, see? Look at that, let go. And so this is the excess skin. It has shrunk down, obviously, but you can see how there is absolutely no bleeding. And then this right here is the orbicularis muscle, this pink structure. And now we're gonna go and continue with the surgery. Thank you. There's a little blood vessel here. This is the nasal fat pad that we have identified, and it's yellow, so it's safe to take out because it is yellow, right? And so now what we have here is a Q-tip on the back of it protecting the eyelid, and that's it. So this is completely dry field, and now what we're gonna do is we're gonna charcoal all these, okay? So we remove the nasal, because it's next to the nose, fat pad, in a completely bloodless manner. ¿Cómo te sientes?
Yeah.
And she feels good. Look at that. Thank you. So now what we're doing is we're barbecuing this stuff. We're charcoaling it. ¿Cómo te sientes?
Yeah.
So this red thing that you see, or pink structure, is the orbicularis muscle. It's a muscle that goes around the eye. And normally with the traditional technique, you cut it. You cut that thing. But what we do here, instead of cutting it, is we electrocoagulate it. In other words, we charcoal it. We make it like a barbecue, right? Because studies have shown that if you cut it, or if you electrocoagulate it, which we're doing, or barbecue it basically, the results are the same. But look at this, much less. No blood at all. This is dry as a bone, right? And this is the patient awake, so much less risk in complications. Zero blood loss. Very comfortable patient, and when you, with the traditional technique, cut the muscle, obviously, you know that muscle is pink and there is a lot of blood vessels, right? So you can cut a blood vessel and it'll bleed. And if it bleeds, that's what happens. You can end up blind. We never had anybody bleed and we've never had anybody go blind, thanks to God. ¿Cómo te sientes?
Bien.
So I keep asking her how she feels. She feels great. Thank you. And now we're gonna do the same on the other side and then close. And this marker, this is the marker is this blue or purple thing is not a bruise. It's just a marking pen. So this is the purple marker, you see, and that's what I was talking about. That it's like it's not a bruise. It's just a marker, right? And look how delicate I am when I do this. I just go down to very superficial here, right? To dermis, this white membrane is dermis. So there, and I follow her crease. So this is where her crease is, right? So that's why we marked it, and that's the crease, right? And we want to stretch it a little bit so that she has more on this side than on the other. So they're not identical, but you see absolutely no bleeding. ¿Y cómo te sientes, huh?
Bien.
She feels good. This is incredible. And so this is just the way we love to do this. Look at this thing is completely white. And we're gonna go ahead and now remove the skin like we did on the other side. And so same thing basically. I use the electrocoagulator and we are going to remove just the skin only. With the traditional technique, you remove the skin and the muscle sometimes at the same time. And you're feeling a little drop that's coming down here. That is fluid. I don't know if you feel it. ¿Sientes algo o no?
Sí.
Como que te estás... no es sangre, es como una lágrima, sí, pero es la anestesia. So that's the local anesthetic that she's feeling there, dripping down. But what you can see, absolutely no bleeding. This is just incredible surgery here at the Cosmetic Surgical Center of Reno, but I am meticulous to the point of being ridiculous. Look, we just don't let anything bleed. I go very slowly, yet very efficient, right? So we're just, can you see from back there, Wendy?
Oh, yes.
How beautiful this is, huh?
Yes.
Absolutely bloodless surgery. We don't like bleeding, man, especially in the eyelids. So this is the Patino method for Blepharoplasty. Absolutely. And the patient decided to go away, right? And ¿te sientes bien? She feels good. We're monitoring her vital signs, her oxygen. You see the little blood vessel here, you guys? So I'm electrocoagulating it. I'm burning it with this instrument, and this is not a laser. This is not radio frequency. This is the same instrument that every other surgeon has. We just use it in a completely different manner, much, more meticulous, right? To the point of being ridiculous, so that there is absolutely, you see that? You see that? And that pink structure is the orbicularis muscle. We're gonna charcoal it like we did on the other side. It's gonna look black in a minute when we do this. But this is incredible. So we're just, going to follow that marked line, right? And when she has the track right there we go. So we have an incredible retraction here by Sylvia, and then we're gonna go ahead and, but look how long it takes to release, right? Yeah, so we're moving along with the retraction more forward. So we're working, and look at that, incredible. It's absolutely beautiful the way we do surgery, right? It's incredible. ¿Cómo te sientes?
Bien.
It feels good. We're coming toward the end of this incision, and you can see again, I'm gonna put it down. You see, this looks smaller because it has shrunk, but this is the area that we remove, right? Pretty similar to the other side. This side is a little more than the other, but notice this is the orbicularis muscle, and we're gonna, it looks pink, but zero blood loss, zero. And we're gonna go ahead and look for the nasal patch. Should be around here, and take it out. Thank you. Okay, so this is the nasal pad on this other side. And again, I'm removing it, whatever is yellow, right? And I'm removing it against the Q-tip so that we can protect her and protect the eyelid and the eyelashes and everything. And notice it's too bad the marker has stained this blue, okay? But we're gonna now electrocoagulate the muscle, right? ¿Cómo te sientes?
Bien.
Yeah, so she feels good. So this is just the muscle being stimulated with electricity, so it twitches, but she doesn't have any pain, right? No te duele, ¿verdad?
No.
No, so this pink muscle, we're basically charcoaling it down. So we're gonna make it. Do you see any bleeding, you guys? Anybody watching, tell us how much blood loss there is here. So how much blood loss you see here, Sylvia? Zero. So we're gonna put zero because there is no blood loss. And this is incredible. The patient awake. ¿Cómo te sientes?
Bien.
Yeah. Incredible. She feels good. She's awake, but she's sedated. We gave her medication by mouth only. And look how beautiful this is. And this is the best part that I love. We're gonna close. I'm gonna show you how we close because this is almost miraculous. How we remove the stitches. You can watch it on YouTube. How we remove the stitches. So you can put Dr. Patino eyelid suture removal on YouTube and you'll see it is miraculous. We'll show you. We'll keep it posted. Thank you. All right, so notice how the way we suture here is also incredible. Absolutely no bleeding, number one, right? Number two, absolutely no pain, right? Very important. Dry as a bone. This field is what we describe in surgery when something is dry as a bone. You get put dry as a bone, right? And we are very meticulous. And you should see how we remove these sutures because notice that there is absolutely no bunching up of the suture. So commonly with the traditional technique, you do this and then the sutures look all bunched up, right? But here we just close literally with no tension, right? The assistant is not over pulling these sutures, but we just let the edges basically gently kiss, right? Right there, see? And that's it. So that way, it doesn't give us any bunching at all, right? And also, when we remove these sutures, we remove them in a completely comfortable manner, in a matter of seconds, probably a split of a second is when we do this. It's just unbelievable, right? And we're very meticulous to the point of being ridiculous, right? And so because there is no knots, we just pull from one side, you know, and the sutures are totally, completely removed. Normally, when with the traditional technique, this may take up to, you know, half an hour or even longer. Usually the person that's removing them has to put a light source, pretty much like what I have now. I have a light source in my head and instruments, like the instruments that. All right, and so normally you have a light source and instruments like I'm using here to remove the sutures. But literally I can just remove the sutures with my own hands, and or you can use a clamp to pull them, but you don't have to be digging inside to do this, you know. You just basically, what I do is I pull on one side and that's it. We are done. Thank you. And basically we're gonna do the same thing on this side. So very, very comfortable. We're just basically finishing the surgery here. ¿Y cómo te sientes?
Bien.
So ya te estamos poniendo las suturas. Estamos acabamos en menos de un minuto, yo creo. Okay, so we're gonna finish in less than a minute, I think. And so what we're doing but no rush here, you know. We take our time and do a very good job. Look how her eyelashes are all preserved, and she just looks great, you know. And the most important thing that we want to show here is the complete absence of bleeding right now. So not a drop of blood. So we're gonna put zero bleeding in the operative report because there is zero bleeding, right? And this is something that, you know, when somebody reads the operative report and they haven't seen the surgery like you've seen the entire surgery, they may not believe, right? They go, oh, that guy is lying, whatever. But it is, you know, sometimes people write these things to me on TikTok that they don't believe that there is no pain. There is, of course, pain, right? But yeah, that's flattering to me because what we do here is unbelievable. So don't believe it. Come and see. Come and see, you know? Come and see, because this is how we do it. You know, it's unbelievable. The patient is awake. ¿Cómo te sientes?
Bien.
So, ¿recomendarías esto?
Sí, totalmente.
She would recommend this totally, right? So, this is incredible. And we're almost done. But do you see any bleeding at all here? It's just, I mean, I get amazed because every day, you know, it's like when, yeah. To me, it's also unbelievable, you guys. I don't believe it also. But I have to believe it because it is real, it is true, and we're showing it to you. So that you may believe. See and believe, right? Yeah, it's that when, and I'm not comparing myself to Jesus Christ by any means, but that's what, in the recent reading of scripture, right? Philip told Nathaniel to come and see Jesus. And Nathaniel says, can anything good come out of Nazareth, right? And then when Jesus saw him, he goes, here's a true Israelite, right? and he said, my Lord and my God. And he goes, do you believe because I saw you under the fig tree? Truly, truly, I tell you, greater things you will see, right? But basically what Philip told Nathaniel is, come and see, come and see the glory of God. And that's why I just went to Mass this morning and, you know, like every day, and I commend myself to my patients. And this is just so beautiful. I feel totally, my hands are guided by God. We're totally done. Ya acabamos. No knots, everything good. Thank you. We're not here. We're done. Everything is perfect. And we're going to just put some stir strips to secure this. And then when we do this, the removal, what I do is I cut this at the skin level, and then I pull. I can literally pull with my hand, and the patient doesn't feel a thing. So we're going to record that on YouTube as well in a few days. So like maybe 5 to 7 days after, we'll remove the sutures. But we're totally done, you guys. Bloodless. And then as a result, she's going to have much less bruising. You saw less bleeding, less swelling. She's not going to have that raccoon eyes look that are typical with the traditional technique. And she's going to be walking. Literally, she can go back to work within days if she wants to. It's incredible. Thank you. Here, what I'm doing now is I'm securing these stairs with the stair strips so it doesn't really like come out, right? But this is just unbelievable surgery. Unbelievable surgery is the Patino method for upper blepharoplasty, right? Or any surgery, really. But we're very delicate, very, very, very delicate with this technique, you know. And this is how it is, right? So, ¿cómo estás? ¿Ahora tienes sueño?
Sí.
Ahora sí te vas a dormir. She didn't sleep. Abre los ojos, abre los ojos. Mira. So she's opening her eyes. I'm going to take the light out. So she looks incredible. She doesn't have that excess fat or excess skin. She looks a lot younger. This is just beautiful surgery here at the Cosmetic Surgical Center of Rosarito. If you would like to have a procedure like this, please give us a call. 510-525-7999. 510-525-7999. Vuelve a abrir los ojos. Ok, muy bien. Saluda, gracias.
Gracias.